This ASH 2018 annual meeting is really a fascinating one. It's a true turning point in the management, in my opinion, of hematologic diseases, especially with the advent of all of these cellular and immune therapies. And as you may guess, the CAR T cells are really the superstars or superheroes of this meeting. We've seen consolidated results from the different clinical trials, but most importantly, we are seeing now large cohorts, relatively large series of patients treated with commercial product. So experience from the real life, I would say, routine practice, further confirming the efficacy whether in ALL or non-Hodgkin lymphoma. But it's not only about ALL or non-Hodgkin lymphoma or CLL. Now we are seeing these cells being developed in AML, and of course very exciting results in multiple myeloma with different products. Interestingly, beside the refractory setting, these cells, the CAR T cells, for example, in myeloma, are moving progressively into earlier courses of the disease, and there is a presentation, for example, looking into CAR T cells in myeloma after induction in the auto-transplant setting. So CAR T cells are all over the place, and I think they do clearly represent a breakthrough and a clear change for our practices in the near future, because we can see progressively, thanks to these CAR T cells, to the different targeted therapies, that the standard conventional chemotherapeutic agents are going to retire progressively. So it's the chemo-free era, and I think for all of us and for the patient, this is good news, especially if you are able to achieve the same level of survival with better safety. Having said this, the excitement about CAR T cells should not make us ignore the role of other cellular therapies, because again, it's the advent of all cellular therapies in the field of hematology. And we've seen discussions and abstracts about gamma delta T cells, NK cells, dendritic cells, but also about CTL, cytotoxic T lymphocyte directed against EBV. And in this meeting, there was a very nice presentation about using EBV CTLs in the setting of EBV PTLD lymphoma with the CNS localization. And as we all know, this is a very hard medical situation, unmet medical need, and where we have little tools, little effective tools to act. And what we could see from this study, that the response rate is above 60%, with a significant number of complete remission, extended survival. Of course, more patients are being treated, but definitely this is really amazing because you're bringing hope into for patients who otherwise can go to palliative care. So I am very optimistic about all of these cellular and immune therapies coming into our field, and it's really an exciting time to be a hematologist these days.